Hi, I'm Lily and I'm a college student at SUNY Potsdam, and today I have some questions about heart disease.
Hi, I'm Lorna. I'm also a student at SUNY Potsdam, and I'm here to answer some of Lily's questions about heart disease. So first, did you know that 1 in 5 females will die from heart disease, and that works out to about 299,578 women in just 2017 alone, and that about 1 in 16 women aged 20 or older have coronary heart disease, and that heart disease disproportionately affects women more than men.
Wow, I didn't know that. So, as a young woman, I never thought about heart disease and never thought that it was that serious.
Yeah, it's really underdiagnosed. And part of that is because it's difficult to diagnose. It is also underestimated and not believed to be a huge health issue. Many young women like yourself feel like heart disease is associated with older people and men, and therefore don't think about it as much.
So, what is heart disease?
Heart disease refers to many different problems that affect the heart. Sometimes it's called cardiovascular disease. It often includes diseases of blood vessels that carry blood to other parts of the body. So, coronary artery disease is the most common. This is when plaque builds up on the walls of the arteries that carry blood to the heart muscle. Over time, this causes arteries to narrow and harden, which prevents the heart from getting oxygen and blood that it needs.
So, how would I know if I had it?
Sometimes you don't know. One of the symptoms would be angina, which is a dull, heavy, or sharp chest pain. Sometimes it's pain in the neck, jaw, or throat, pain in the upper abdomen or back. When resting or doing regular daily activities, women may feel nauseous, feel like they have to vomit, or fatigued.
What are some of the risk factors that are associated with it?
So some of the risk factors include diabetes, obesity or being overweight, unhealthy diet, not enough physical activity, or too much alcohol consumption.
Are there different types of heart disease that women may experience?
Like the one I mentioned before was angina, which is a sort of a pain or a dull or heavy feeling in your chest area. It's really common, and it can happen anytime, whether you're doing physical activities or if you're just stressed. But it can be dangerous because it can lead to a heart attack or cardiac arrest. The other type of angina is variant angina, which is really rare, but is caused by a spasm in the coronary arteries. The trigger to spasm can be cold weather, stress, smoking, or cocaine use. It leads to painful heart attacks, often while resting or sleeping. This type of unstable angina rarely causes heart attacks and can be treated with medicine. So the other type is cardiac syndrome X. This is a health problem that happens when people with healthy, unblocked arteries have chest pain and coronary artery spasms. A spasm is when an artery pinches itself closed. So what usually causes this can be coronary microvascular disease, which is found in tiny arteries near the heart. Women who experience these are often younger than 50 and have a higher risk of heart attacks. MDV affects about half of women with cardiac syndrome X. The other cause is hormone changes. So changes in estrogen levels after menopause can make women more likely to have heart attacks. Most women experiencing this are postmenopausal or going through menopause.
I didn't know that.
The third type is broken heart syndrome, which doesn't sound real, but is very real. It's usually caused by stress, which induces the cardiomyopathy, which can happen even if you're healthy. So it's often triggered by extreme stress, fear, anger, or surprise, and it's more common in women than men. A surge of stuns to the heart, it doesn't usually cause permanent damage, but short-lived symptoms.
Oh, I feel like we've all experienced that before. So what are some of the ways that I can reduce my risk of getting heart disease?
So it's like we said before, some of the causes are unhealthy diet or not an unhealthy diet or not exercising enough. So you can do those things. The other stuff you can do is know your blood pressure and keep it controlled. Talk to a doctor about being tested for diabetes, quit smoking, check blood cholesterol or triglycerides with doctor. Make healthy food choices, limit alcohol consumption, and manage stress.
Huh. Wow, I didn't know all of that about heart disease.
Yeah, it's good to know that there's different types of heart disease too and different ways to prevent it. And yeah, I think most people don't, women at least, don't think about heart disease as something that can happen to somebody who's younger than maybe 50.
Yeah. Well, thanks for answering my questions.
Of course.